Hi, my name is Michelle, and today's video is going to be around the administration of insulin. So insulin is used in diabetes. There's type 1 diabetes and type 2 diabetes. For each different type, you would use something different depending on what your body needs. Insulin is a hormone that's made by the body, and it'll regulate your blood sugar from getting either too high or too low. There's 3 main injection sites for insulin. There's the abdomen, the arm, and the thigh. The abdomen is the preferred site because it allows for rapid absorption and is easy to reach. You would want to do this 2 inches from the navel and between the top of the ribs, the bottom of the ribs, and the pubic area. The next area that you could inject insulin is the thigh. You would use the top or the outer areas of the thigh about 4 inches down from the top of your leg and 4 inches from above your knee. Lastly, you have the arm. You would use the fatty area on the back of your arm between your shoulder and your elbow. Before administering insulin and any medicine, you would want to review the 6 rights. Right patient, right dose, right route, right time, right location, and right documentation. You always want to check the quality of the insulin before administering it. If it's mixed with other insulins, you would want to see that it's not cloudy. So if it is, you would want to roll it between your hands and do not shake the vial. For insulin that is not mixed with anything else, it would not be cloudy, so you would not want to administer this. You would also never want to administer any insulin that looks grainy, thickened, or discolored in any way. Before I give my demonstration, I'm going to review the steps of administering insulin. I don't have all of the supplies, but I'm going to use this as my needle, and this is my insulin bottle. First, you would want to hold your syringe upright, the needle being on the top. You would want to pull your plunger down to the desired amount that you plan on injecting. Next, you would want to remove the cap from your insulin vial. If you've used it before, then you would want to take an alcohol swab and make sure you sterilize the area. Next, you would want to push the amount of air into the vial so that you can get the desired amount. So you would push your needle in. The air will replace the amount of insulin that you are planning to withdraw. There is solution in this. It's an essential oil, so I'm going to keep the top on just for purposes that nothing comes out of it, but you would have the top off. So next you would draw back your plunger to get out the actual insulin into your needle. Now that you're ready with your insulin prepared, you would go into your patient's room, introduce yourself, wash hands, and make sure that you have the right patient. You would then clean the injection site of your preferred site that you're choosing, and you would pinch the skin, inject the needle, unpinch the skin while you administer it, wait 10 seconds, never rub the area, and then discard your needle in the sharps container. Now that the preparation and the steps of preparing the insulin have been explained, I will now walk into my patient's room and administer the insulin. So I would walk into the room, I would introduce myself to the patient, I would say, "Hi, my name is Michelle and I'm going to be your nurse today. I'm here to give you your insulin." I would make sure that the patient understands why they're getting insulin, obtain baseline blood glucose levels before administering, so I know how effective the insulin is at the dose, and I would also want to wash my hands before performing the procedure. So I'd wash my hands. I would tell the patient, you're going to be getting insulin today because your blood sugar is too high. I would say I'm going to do it in the abdomen. It'll be a quick pinch, and then it'll be over. So I'd also want to make sure that I have the right patient. So I could ask the patient to give 2 identification, either name, date of birth, maybe a social security number, and also check that they have an ID bracelet that says the same information they're giving you. So I already have my insulin made up. This is my needle, my plunger side. I would go in, I would clean the injection site first to prevent infection. I would squeeze at the abdomen. I would inject, release, and push in the plunger. I don't want to rub the site at all. And then that's the end of the injection. And then I would want to put this into the sharps container so that it doesn't harm anyone.